Hi, I'm Joni Ye. I'm a pediatrician, and with the quarantine and canceling baby's well visits, the conversation I miss the most is how to start feeding a baby with solids. That is a conversation we have at the 4-month visit. So in case anyone has questions on how to start their feeding their baby solids and they've missed their 4-month visit, you can listen to my thoughts. These are my thoughts. They're my rambling thoughts. I do not represent my institution or any institution that I am affiliated with. And it is not medical advice. So if you have questions about feeding your baby, please talk to your child's doctor so that you can formulate a specific plan for your child with your child's doctor. You watching this video does not establish a patient-doctor relationship with me. And again, these are my thoughts only. It is not medical advice. So when babies should start feeding solids, that's what we're going to talk about today, is when they're about twice their birth weight. About at 4 to 6 months of age. They should also be really curious and watching the family members when they're eating, kind of staring at you. I have a 3.5-month-old at home, and since she's been 3 months old, she has been eyes wide open, watching her food on the table. And sometimes when I tease her a little and put food on the fork and kind of bring it close to her mouth, she even opens up her mouth. And I know I'm so mean. I'm a horrible mother. But I've been patient and I haven't offered her any foods yet, and I will do that when she's 4 months old. So the baby should also have pretty good head control because you don't want their heads flopping around when they're trying to eat. You don't want them to choke, so they have to have good neck control. So that pretty means that they're pretty stable when you're holding them at their hips. They should be pretty stable and not kind of like flopping this way or that way. So good neck control, twice their birth weight, and seems like they're interested in food. So when babies are doing that, we can start with cereal. Now, the reason why we start with cereal is because it's cheap and easy to make. So you can, the cereal comes in a powder, and you can mix it with 1 or 2 ounces of breast milk or formula. You want to put about 3 teaspoons in there so it's a pea soupy consistency. And then you put it on a spoon and bring it close to the baby's mouth, and you just kind of dump it into the baby's mouth. Once the baby understands that they're supposed to get the food off the spoon, and so they close their mouth over the spoon and opens their mouth when the spoon comes, close to them, then you can make it a little bit thicker and consider offering other foods other than cereal. So the cereal, rice cereal, oatmeal cereal, barley, mixed grain cereal, it contains iron. So the benefit of that is iron is very important for a baby's brain development, and we like that. So the problem, however, is that iron can also be very constipating, and so can the rice. So I generally recommend starting with oatmeal cereal because it can be a little less constipating than rice cereal. When you start feeding the baby, I recommend feeding the baby 3 times a day. So offering 1 or 2 ounces 3 times a day, so that when the family sits down, then the baby also gets offered some food. The more practice, the better. But every family is going to have their own, figure out their own routine and rhythm of feeding the baby. There's no one right way to do it. So if a family finds it's more convenient to do it in the morning, they skip the lunch and then they offer again at dinner time sometimes, that's perfectly fine. And you want to try one food for 3 or 4 days before you move on to the next, just to look for any allergic reactions, which may be vomiting, watery diarrhea, a rash, obviously problems breathing. So you want to wait 3 or 4 days to make sure there's no reaction that you can offer the next food. So if a baby starts out eating oatmeal and is offered oatmeal 3 times a day, and after 3 days there's no reactions and the parents want to introduce rice cereal, they can continue to offer the food that the baby's been eating. So you can continue to offer the oatmeal cereal. And in fact, they can do oatmeal for breakfast, then rice at lunch, and then oatmeal again at dinner time, just so the baby's not getting too much rice because it can be a little constipating. You can also then move on once the baby, is opening their mouth and closing their mouth over the spoon, getting this food off the spoon, once it's no longer mostly ending up on our face, on the floor, on our clothes, on the baby's face, then you can offer other foods like pureed zucchini, pureed squash, pureed sweet potatoes, pureed carrots. Generally, we try the vegetables first because we want the babies to get used to that taste before they try the sweet fruits. And then once you've offered one food and you're looking for the next food to offer, try to pick something that's a different color than the last food you tried. That way, if the baby is eating a rainbow, then you know that they're getting a wide variety of nutrients. Once you've tried all the fruits and all the vegetables, you may then be approaching 6 months old, and at that time the baby's stomach can digest more complex proteins, so then you can also offer meats, fish, eggs, and at 6 months you can also offer water in a sippy cup. So I like to make my own baby food, and it's pretty easy and it's cheaper to make your own. So basically you just steam and puree, and you're gonna have a lot of baby food when you make it that way, so then you can just dump the baby food into little ice cube trays, and then freeze that and thaw it when you're ready to use it. Just a tip, when you puree zucchini or squash, it might be a bit watery, or you might need to add more water to make it a more consistent puree. And then in that case, you want to add some cereal to the puree to make it a little bit thicker so that baby can eat it. When I make my own meat baby food, I make a chicken broth, and then I put the chicken pieces and the broth. I don't add any salt, so I discourage adding salt or any extra sugar to the baby's food, because that's not too good for their bodies, and the extra salt's not good for their kidneys. So just add the chicken broth and the chicken into the blender, puree it, and then you can mix it with a cereal and give that to the baby. Of course, you can also buy the baby food, that's fine too. So generally we start giving babies peanut butter at about 7 to 9 months of age. Because peanut butter can be a little sticky, I recommend mixing it with oatmeal and also some bananas to sweeten a little bit. We used to not give babies peanut butter until like they were 1 or 2, but then some research studies found that babies are more likely to become allergic if they are given the peanut butter later in life, so we start earlier. Now, of course, this is not medical advice, so every family situations and medical history might be different. Please talk to your child's doctor to formulate a specific plan for your child, especially if there's food allergies in the family. You want to maybe be a little bit more careful and come up with a different plan. So I just wanted to offer a couple of hacks when offering babies yogurt. I usually get a big container of whole milk yogurt, and then I fill maybe a 1 or 2 ounce container 2/3 of the way with the yogurt, and then mix baby fruit into the yogurt, so that way I know exactly what the baby's getting. It's less sugar and it's cheaper to make it that way. You can also buy yogurt from the grocery store, baby yogurt too, just more expensive. And the other thing to watch out for is when you're buying baby yogurt, you want to make sure that there's live cultures in it. So you want to read the label, especially the yogurt that's on the shelf. Not in the refrigerator, but on the shelf, there's no live cultures in there. So you want to read the ingredients and make sure it reads live cultures, because that's one of the benefits of yogurt, is having the live cultures to, theoretically populate the intestines and make it healthier. For apples, because applesauce is so readily available and cheap, I don't buy baby apples. I just get a big container of applesauce, and then I put it in the ice cube tray, freeze it, and then take it out to thaw. Though I don't think I have to do it this time, because I have 2 older kids who will be thrilled to eat the applesauce, so it's going to go pretty quickly. One absolute is to not give babies honey before the age of 1, because then they can get a disease called botulism that makes them floppy, and we don't like floppy babies, we like strong babies. So no honey before the age of 1. So next up, you might be wondering how to start giving your babies chunkier foods or finger foods. So that's the next topic that I'm going to share. Again, this is not medical advice. These are just my pediatrician mom rambling thoughts. They do not represent any institutions that I'm affiliated with. So I hope that is helpful to some people, but please talk to your child's doctor to formulate a specific plan for your child. Have a great day. Bye.